All right, our next topic on the Rush Hour Roundtable tackles the addiction crisis here in America. Walgreens, CVS, and Walmart have all been ordered to pay two Ohio counties $650 million for their part in fueling the opioid crisis. Now, the U.S. opioid epidemic has caused more than 500,000 overdose deaths over 2 decades. In a statement, Walmart said in part, instead of addressing the real cause of the crisis, like pill mill doctors, illegal drugs, and regulators asleep at the switch, plaintiffs' lawyers wrongly claim that pharmacists must second-guess doctors in a way the law never intended. And the American Medical Association says the nation's drug overdose epidemic continues to worsen. It's driven by fentanyl, methamphetamine, and cocaine. More than 100,000 deaths reported between December 2020 and December 2021 in only 1 year. So, panel, how do we start fixing a crisis that only seems to be getting worse? Should pharmacies continue to be held accountable? Julio, let's start with you.
I think it's ridiculous to hold the pharmacies accountable. I think it's the culture in American healthcare at this point. And I think a lot of it is influenced by the pharmaceutical lobby. We've become a country where we're no longer interested in actually treating ailments. We'd rather treat symptoms. So, it starts with people going and getting a prescription for Percocet, and it ends with people eventually being addicted to opioids and probably doing street-level heroin. The other big issue, I think, in this crisis is something that was touched on the show before we started the panel, which is obviously with the immigration crisis, not having the border shored up. A lot of drugs are coming into the country. A lot of drug dealers are coming into this country, and obviously a lot of dangerous fentanyl. And I think that that's been, a big contributor to this over the last couple of years.
I have a lot to say about this because Trumbull County is one of the counties that is part of this class action lawsuit. I am from Trumbull County. I am sitting in Trumbull County. I represented Trumbull County for a decade while this opioid epidemic was raging on. I want to address one thing that was said in the Walmart statement about this, about we need to deal with pill mills. In the state of Ohio, we did just that. That was where we started. We addressed the issue of pill mills. We shut down overprescribing of doctors and dentists. We threatened their licensure and everything else, which was the right thing to do. But we didn't think about the consequences of that because these people were already addicted. And we ripped off the Band-Aid and we did not give any kind of safety net to these individuals to wean them off, to get them into methadone or Suboxone programs, medically assisted treatment, which really, frankly, we didn't even know that much about 10 to 15 years ago. It's something that is a little bit newer, at least Suboxone is. And so, at this point, what we did with trying to deal with the pill mills, even though it was the right thing to do, we didn't think of a more comprehensive approach. So we were part of the problem. And we ended up creating a situation where these people couldn't get the pills. They went to the streets, as Julio was saying. They got heroin. That heroin was then laced with fentanyl. People were overdosing. Then you had to get the Narcan to get these people out of the overdose. And the situation goes on and on and on. So this is a much larger and more complex issue. Maybe the prescribers, the prescribers are part of the problem. Maybe the dispensers are part of the problem, but they're only one part of a multifaceted issue that the public and private sector and the healthcare sector all need to be together working towards a solution.
And it's important. These pharmacies, they have decided to try to appeal this as well. These pharmacies are not really agreeing with this decision. And I understand it shouldn't be a pharmacist's job to override a doctor. Now, unless the pharmacist has a piece of paper in their hand and it's written in crayon and just says drugs in all capital letters, really blame the pharmacist for a lot of this. If you want to crack down on anybody, we're not talking about the illegal drugs that are flowing through the border here. We're talking about the way that it works from doctors' offices to pharmacies. If you want to crack down on anybody, it's who's a legitimate doctor, who's not. What constitutes an official pad and prescription and what doesn't. I hate to get more government involved because 99.9% of the time, more government is not the answer. But telling these pharmacists, you're the ones that have to crack down and make sure that this isn't bogus and overrule a doctor if you have to, just sounds like a really bad idea.
I think that there's blame on both sides, actually. So I tend to disagree with what the last panelist just stated. I think that there are ways that if you're a pharmacist and you continue to see prescriptions coming in from the same doctor's office, you should flag it. It should be a flag, particularly if it's from the same patient or person or a couple of people that are coming in on a regular basis. Now, I agree that it's not the pharmacist's responsibility. It's not the responsibility of CVS or Walmart, but they do have a moral duty to flag, doctors' offices or places where they're seeing high levels of prescriptions coming in, just so that, doctors' offices or the FDA or whomever needs to be notified at the federal level is notified. And so to just pass the buck and say, well, it's the doctor, we're just passing around responsibility and blame when all of the parties involved can do something to lessen this crisis that's happening in this country.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.